My name is Joachim Kerkan, for those of you who don't know me. I work as an outreach and recruitment officer within SINFO, and I will play the role of the moderator today. I am in the room with three other colleagues. There is Gary, there is also Gabriela and Nicole. So webinar might look quite easy from the outside, but from the inside I can tell you that there is a big technical setup behind it, and we have been practicing for 2 hours now to make everything ready. So we hope and we're confident that it will work well now. On the other hand of the line, we have Paolo and Senan. So Paolo, you can turn on the webcam now so that we can see you live. There we go. So I hope you have our colleagues on the screen as well. So hi to both of you, first of all.
Hello. Hello, everyone.
So we can see you perfectly well, and with New York in the background, which is quite inspiring as well. And yeah, now in terms of participants, we have around 50 people who registered to this webinar. Around 30 of them are now logged on. Hopefully some other people will join us along the way. So we have different kind of profiles within the participants. We have reproductive health specialists, but we also have other kind of profiles, people from the Swiss ministry, for instance, people from other UN organizations as well. So yeah, we hope we'll have great exchanges today. And again, to all of you, welcome to this webinar. Before starting, I briefly would like to set the scene and tell you a couple of words about why is SINFO doing this work. So this mandate, or this work is part of a mandate we got from the Swiss Development Agency. UNFPA is a strong partner of SDC, and SINFO was tasked to increase the visibility of UNFPA among the reproductive health network in Switzerland and other professionals in Switzerland and overseas. And we also got the mandate to support people in applying to UNFPA. This is why we chose this structure with a webinar on the one hand, accessible to everybody, where we can share information and discuss openly about UNFPA. And afterwards, we have this second part where people can apply for an individual consultation. This will be a talk with Paolo later on. I will tell you more about this second stage or option at the end of the webinar. Okay, but now to focus on the program for this evening, first of all, we'll give the floor to Senan, who will talk about the work UNFPA is doing in the field of reproductive health, and then we'll switch to Paolo with the HR dimension, the topic of today being working in reproductive health with UNFPA. We'll try to bring the two dimensions into this session. In terms of technical question, I have on my notes technical issues. I hope we won't have too many technical issues. As you could see, and I said at the beginning, we're not using a microphone, or at least we're not giving you the option to use a microphone, but we'll ask you to ask your questions within the chat or the question box. And here we have our colleagues, Nicole and Gabriela, who will manage the question side. And I will moderate in order to bring your question to the audience and above all to Paolo and to Senan. If you face any technical problem within the webinar, during the webinar, you can always write to us, or you can also call directly on our mobile phone number, the one we have with us here. I'll give you quickly the number, but then you can always write. So this number would be 079 303 0805. 079 303 0805. Hopefully you won't need to dial this number today. Okay, and on top of that, we will activate some surveys, what we call polls, along the presentation so that we can get a bit of an interaction with you. And I would propose to start right away with my first question to you, which is how familiar are you with the work of UNFPA? Okay, so you should see this question now on your screen, and then you can just tick on the box, and I'll get the results right away on my screen. Okay, so now I can see that poll is in progress, and I can see that most of the people here, around 75%, have some knowledge of their activities, the activities of UNFPA. 10% are very familiar with the work of UNFPA, and 20% rather familiar. We are glad to see that nobody ticked, this is my first experience learning about the work of UNFPA. Okay, so apparently the audience is pretty familiar with the work of UNFPA. This is good. All right, so I close the poll now. And so we'll be able to start with the presentation of Senan, which is our first block. So Senan, you are a medical epidemiologist with expertise in maternal and newborn health as well as health system. Myself, not being a reproductive health specialist, I had to type this in Google. I think I have a pretty clear idea now, but I'm still looking forward to hear you about the work you're doing in this field. You hold a PhD in public health and work as a technical advisor at UNFPA headquarters in New York. So we're now looking forward to hearing you about UNFPA, but also about your everyday work, your main challenges, and the tips you have for people interested to engage with UNFPA in the field of reproductive health.
Thanks, Joachim. Good afternoon, everyone, from wherever you are. I'm very thrilled, actually, to be part of this webinar. And this is actually a proactive exercise that our Division of Human Resources has been taking since a couple of months. And we are very happy that people have joined. And given that most of you are to some extent familiar with our work, maybe I will give a tune-up to the presentation to what I have planned to do. By saying at the outset, if you are passionate about human rights, if you are passionate about sexual and reproductive health, we would like to have you work with us at UNFPA. That could summarize the whole presentation. But let me just go quickly through what I have planned to present to you. You know already what UNFPA is the United Nations Population Fund. Some of you actually may wonder why it is UNFPA. It's originally United Nations Fund for Population Activities. That's what the acronym stands for. It was part of UNDP, and over the years, it has become an independent organization and is primarily focused on development and population issues, promoting rights of everyone to enjoy the health and equal opportunity. So what do? We want to make sure that we have good data at population level to inform policy and to inform program to make sure that every single pregnancy is wanted, every birth is safe, and every young person potential is fulfilled. What do we mean by that? Every pregnancy is wanted. That means that everyone has access to family planning so that the timing, the number is of their choice. We make sure that when people do choose to bear a child, the mother and the newborn are safe. And we want to make sure also that every young person is free of HIV and is treated with dignity. So in terms of population, for example, I'm sure you are very familiar with the work of our demographers, looking at whether it is aging, whether it is migration, whether it is urbanization, In fact, maybe you know, or some of you may know, that Werner Hogg, which is your compatriot, who has led the Swiss National Statistics Office for many years, has been our technical division director, and now is our regional director in Eastern and European countries. So that's an example of what we do, for example, supporting censuses, supporting household surveys, demographic and health surveys, any household survey in countries, developing monographs so that we could link the population data with the reproductive health needs of the countries. When we move, for example, to specifically maternal health, for example, when we say every pregnancy is wanted, that refers specifically to family planning. And I have indicated, you can see in this slide, how to make sure that from the manufacturer down to the last mile of the women in the village, the girls in the village, making sure that they have the commodities is an important part of what we do. But also the services, that they are free of coercion, that they are gender sensitive. That's an important part of what we do. And specifically, most of you have heard about the Family Planning 2020 initiative, which is this global initiative to make sure that the over 200 million of women who currently do not have access to family planning can actually exercise their right to family planning. Beyond family planning, let's go to the next one. When women do get pregnant and they choose to bear a child, as you know very well, to make sure that we have maternal and newborn survival after this event, you want to make sure that the women are attended by a skilled provider. Training, having an appropriate cadre of midwifery, training, retention, motivation, those are some of the work that we do. In fact, we have a flagship midwifery program that we can talk about and that you can also read about. But beyond that, when there is a complication, you want to make sure that you have emergency obstetric and newborn care available. Just to pick an example, when there is an obstructive labor and the baby cannot come out naturally, you want to make sure that you have someone who can perform C-section and ensure that the mother and the baby are safe. So let's move to another area, for example, HIV. HIV, we have many partners in HIV, and the specific comparative advantage of UNFPA is to work with other agencies for elimination of mother-to-child transmission of the HIV, to ensure SRH, sexual and reproductive health, and HIV linkages, so that we integrate. For example, when you get a child and you go to postpartum, for example, that you can have right there already the choices of contraceptive offered to you, so that you are not going to another services to look for these commodities. Or, for example, for the young and adolescent, have a condom programming initiative in the country so that the young and adolescent they can access these contraceptives. And lastly, work with comprehensive sexuality education in school, but also for out of school, so that they have appropriate information to prevent the HIV and later AIDS. And also, an important part of what we do is the human right and the gender aspect, ensuring dignity and respect for every woman and every girl. And some of the specific programs that we have, for example, is gender-based violence program, particularly in humanitarian setting. Or, for example, female genital mutilation and cutting. We have a joint program with UNICEF over 20 countries where we try to reach abandonment of the practice. We work with stakeholders, community leaders, religious leaders to put a stop to this program. And also, on that note, I would like to mention obstetric fistula, which is, we will say, the example of the human rights violation to women and girls. When you have, as I mentioned earlier, endocritic labor, and you don't have access to someone to remove the obstacle, you ended up with a condition we call fistula, which is a hole between the vagina and either your bladder or sometimes the anus, and therefore you have urine leaking for the women. Very debilitating condition that we do not wish for anyone around the world. Let's move to the next slide, please. Another work that I mentioned in the humanitarian setting. The world is going through a lot of challenges, whether it is in conflict situation like in Syria, in post-conflict, in Libya, so many countries. Central Africa, for example, is a case that is being discussed as we speak at the UN to get a resolution to prevent a genocide. So we have many humanitarian situations, whether man-made or non-man-made, in countries, and in every single of those situations, you want to make sure that the rights of the girl and the women are protected, because often they are victims of rape, they are victims of other violations, and they don't have access. Some of them are pregnant and need to be attended to. So what do? We make sure that we have the minimum package of reproductive health kits available in this setting, and we make sure we work with other agencies to make sure that they have the services for dignity. Next slide, please. So this is, in a nutshell, what we do. We can expand on every single one of these, but let me finish by where I started. If you are familiar with the work of UNFPA, and for the small slide that I show you, this work is very challenging, and it requires passion, it requires dedication. So if you are passionate about protecting human rights, you are passionate about sexual and reproductive health, again, we would like to welcome you at UNFPA. Thank you very much.
Okay, back to us. Thank you, Senan, for this. Maybe let me just ask you a question. First of all, with regard to the institutional development or the organization, could you tell us more about where you stand now and what will be the challenges ahead for UNFPA in the framework of the mandate of the organization?
Yes, in fact, from next year to 2017, we have a new strategic plan. And primary focus of this strategic plan is two flagship strategies that we have developed as part of the Executive Director Business Plan. One is the family planning strategy, and another is the adolescent and youth strategy. There are a lot of institutional challenges related to those, because to make sure that the 220 million women around the world who do not currently have access to family planning, voluntary family planning. It requires a lot of partnership, it requires a lot of funding, but also it requires a lot of program and quality health service. So it represents a challenge for us to deliver, because we are the lead agency to make sure that this happens. The other thing is, as I mentioned, the focus on adolescent and youth. We have not done that for many years, but it is not just by chance. When you look at demographics, you see that in many countries, 20 to 30% of the population are adolescent and youth. So think about it. The choices and the opportunity that those adolescents, 10 to 14, 15 to 19, will have today in terms of sexual and reproductive health rights, and for the year to come, will actually shape how we will have the world in 20, 30 years. So we have decided as an organization to put a focus on this age group by doing what? By doing, first, having very important data, credible data, to analyze the situation across countries and within countries across the region. Secondly, by making sure that we have a comprehensive sexuality education, because we believe that if they have the good information where they need to have it, where they used to have it, that will be very critical. And thirdly, by making sure that the services are tailored to the needs of these adolescents and youth. Myself, I am a physician, like you mentioned, and I have witnessed firsthand when I was still practicing in my home country, Benin, teenage pregnancy, HIV among very young people, etc. And now that I myself have a teenage adolescent, I can understand the challenges that my parents had when they were raising me, and now even more with the age of the social network. I'm struggling big time with my teenage adolescent girl to get her focused on the studies, because we know that when we keep girls in school, we will have achieved 50% of all of the things that we've been discussing. So that's some of the challenges that we have.
Mm-hmm. Okay, thank you. Before moving on to the next question, I will activate another poll to the people. In which field of reproductive health are you specialized, if you were specialized in reproductive health, so that you can have an idea, Senan, about the profile of our public. And while the people are answering this question, I'll ask you another question, Senan. Could you tell us more about your function and responsibility within UNFPA? What is your role? How does your everyday work look like? And also, what are the main achievements and challenges in your work?
My official title is Reproductive Health / Reproductive Health Commodity Security Technical Advisor. Sitting at Technical Division, I will tell you rapidly the function of the Technical Division vis-a-vis our regional office and our country office. The Technical Division provides technical leadership. We do advocacy, we do partnership, we develop technical guidance and tools, and we conduct sometimes training of trainers so that those could be replicated. And particularly for someone like me working on a thematic fund. Thematic funds are special dedicated funds to special program areas such as family planning or maternal health. For someone working on thematic funds, you work more closely with the countries and the region to make sure that you deliver on the result framework that is set forward within that thematic fund. So that is generally talking about the function of anyone sitting at technical division. As of myself, those are aligned with the function of the technical division. So for example, I just came back from Nigeria on a mission in Nigeria, in northern part of Nigeria, Sokoto and Bauchi. They have been implementing a community-based distribution of misoprostol to prevent postpartum hemorrhage. As you know well, because most of you are experts in reproductive health, we do have a WHO guideline. And we want to make sure that the intervention first is being developed to ensure equity and ensure good coverage, but also to ensure quality. We want to make sure that we can track some of their death events, we can track incidents of postpartum hemorrhage, and most importantly, that we have the health system in place to ensure greatest maternal and newborn survival. Because we know that even if all the women, pregnant women, are using misoprostol in northern Nigeria, we only prevent up to 70% of postpartum hemorrhage. And the other causes of death whether it is obstetric labor, whether it is a sepsis, whether it is eclampsia, they are not going to be prevented by misoprostol. So that mission was conducted jointly with the regional office and with some partner, GSI, to assess all this. So that's an example of what we do in country, for example, supporting the country. In terms of the regional office, we support our regional offices in identifying implementing partners. An example I can give you, working in emergency obstetric and newborn care, we will conduct assessments in countries. These assessments, we do them in country with national and regional institutions. So having, for example, a regional institution, for example, in Burkina, we have an institution that has been helping other countries to conduct this assessment after developing their expertise. This is an example that we do. Partnership. Just about 3 weeks ago, we were in Dakar to have a meeting with our regional office, with the World Bank, to develop a framework of collaboration for the Sahel country. And through our participation and technical support, as you know, some of you may know, World Bank just committed to $100 million to support the Sahel in reproductive health. As of my role in technical division, few months ago, I led with WHO the development of a technical guidance for maternal death surveillance and response. This is available on WHO website, and you will see my name is specifically written as one of the leaders of this technical guidance. And another technical guidance that we are currently developing is an interagency guideline to complement the handbook that we have developed to do emergency obstetrics and newborn care assessment, so that after this assessment, country could know what to do. Currently, it is left to each country to decide what they do and how they do it. And we felt that we needed some advice in that area. So those are just some of the examples. And of course, the whole monitoring and evaluation, supporting country, for example, in doing the reproductive health commodity security check to assess the need of family planning in country. These are some of the things.
Mm-hmm. Okay, thank you, Senan. We have the results of the survey here on our screen. So just for you to have an idea of the audience, we have around 25 people with a background in maternal health, 43 people with a background in family planning, adolescent and sexual reproductive health, 35% with a focus on HIV/AIDS, and 20% with a focus on gender-based violence. And then another 35% of people with backgrounds in different fields. Okay, so Thenan, thank you very much. I guess we'll move on with the next stages of the presentation, and we'll come back to you, to your background and all of these later on during the question phase. To the participants, again, whenever, if you like, to ask a question to us, to the presenters, don't hesitate, and please type it. Okay, so now we'll move on to Paulo and to the HR side of the presentation. Starting again with another poll. The question here, have you already applied to UNFPA? Or to broaden it a little bit, have you ever been to the job site of UNFPA? So I see the people answering now. We have a clear percentage in the no category. So Paulo, I can see here that around 80% of the participants have never applied to UNFPA, which means that it's going to be your challenge now to make them apply. And then, to keep on talking about this career dimension, for the participants, we are very pleased to have Paulo with us today here. So Paolo Bernasconi is now working as an HR specialist at UNFPA headquarters, but to what I could see from my exchanges with Paolo, he travels a lot around to field offices, doing staffing, doing different things. So I think he's got an excellent overview of the work of UNFPA and the HR challenges that are faced from the field perspective. Before that, Paolo, you were in Bonn. And before that, most importantly, you worked for Sinfo with us here in Biel. So it's always a pleasure to have you back with us here. So Paolo, we look forward to hear you now about UNFPA as an employer. I see that you prepared some slide about the staffing structure of UNFPA as well. And again, to give us your tips about how to get on board with UNFPA. If you don't address it in your presentation, we'll make sure to come back to you afterwards with plenty of questions. So Paolo, the floor is yours.
Thank you very much, Joachim. And it's, of course, a pleasure for me to be back, at least virtually, in Bienne with Sinfo. So you see the slide who we are, is that correct?
Yeah.
Yes, very good. Okay, so as you see, we have around almost 3,000 staff members on a fixed-term contract all around the world. We have actually, in total, we have much more because we have many staff members on a service contract or on a temporary contract. So you have at least to add 1,000 more to this at different levels of temporary and service contract level. And 400 out of the 2,900 are in New York. We work in more than 150 countries all over the world. Of course, most of our activities are in sub-Saharan Africa, but we really work globally all over the world. We have 6 regional offices, 2 in Africa, 1 in Latin America, 1 in Asia, 1 in Eastern and Central Europe, and we have actually 3 sub-regional offices, and the interesting is 6 liaison offices, among them 1 in Geneva, Switzerland. We have a total of 600 international professional staff. So this is the post that you would be looking at if you want to apply. We have almost a complete gender balance with 49% female and 51% male among our staff. What is interesting for UNFPA is that we are really very much a southern-based organization, and actually the distribution is totally wrong. So we have actually, so the 55 and the 45% is what concerns fixed-term staff. But if we count also the temporary staff, it turns exactly on the other way around. So 55 south and 45 north, which means that really among our workforce, we have a very diverse workforce, and we have also people from almost all the countries. Now this brings us to the little, I would say the little unhappy thing, particularly as a Swiss, and for you as a Swiss audience, we, out of these 3,000 people, we only have 3 Swiss. One, as Senan mentioned, the director in Istanbul for Eastern Central Europe and the former Soviet Union. And then we have 2 at the P4 level, this is myself, and 1 midwife in an important midwifery program in South Sudan. In 2012, we had 97 Swiss who submitted total 173 applications. And this year so far, in the first 11 months of this year, we had 71 Swiss who submitted 143 applications. So we have 30 people now listening to this webinar. If you all apply in this month, we managed to beat next year's statistics. So this is, of course, for us important, and for Sinfo even more.
Paolo, sorry for interrupting. Can you tell us in terms of percentage, what does this mean? Like 143 applications out of how many?
Oh, this I don't know, but it's really, I can check that while you will ask a question to Senan later on. I'll go into the system and I'll be able to tell, but it's really unfortunately, it's, if we have 3 out of 3,000, I would assume that the proportion of staff is more or less the same.
Okay.
But I'll be able to give you that figure later on.
All right, thank you.
And this is just to give you an indicative idea. So for the different posts, what kind of and how much you need of professional experience in order to fulfill the minimum requirements. So you see that we have really from a minimum of 2 years, so which means also that UNFPA does not have a new graduates program, so you need at least, even for the very entry post, you need at least 2 years of experience, up to 15 years if you want to come in at the higher level. So which means that UNFPA, unlike other organizations who have new graduates or a young professional program, we don't have that, so you really need to bring already a certain degree of professional experience. There are still entry opportunities in UNFPA, although we don't have an entry-level program. Internships are unpaid, and I'll come back to that later on. The interesting is that you can also do internship in Geneva at the liaison office. You can also do internships at the regional offices. You can do internships at country offices. So I'll come to that later on. We have just a German who has just left for Burkina Faso for a 6-month internship with our country office in Burkina Faso. The JPO program, and this probably Sinfo is better able to respond if there are questions on the JPO program. We are welcoming, after 2 years interruption, I think, again Swiss JPO. We have UNB volunteers. This again, Sinfo is surely the better one to explain to you, but we have a number of UNB who are serving in the field as UNFPA employees, and the UNB professional experience counts fully towards your professional experience. So it's not that it's as a volunteer experience is disregarded, it's considered the full experience. In fact, our human resources director has started himself like 22 years ago as a UNB volunteer. We have then the consultant roster, and for the consultant roster, I immediately need to say that this is really for very high-level expertise and also like for very specific expertise. So in the roster, really, we look for people when we need like a very specific expertise in maternal health or reproductive health, or if we need somebody who is really able like to manage programs at the high level. So this is actually not an entry opportunity. And then, of course, we have the current vacancy.
Paolo, may I ask something?
Of course.
With regard to the roster, could you tell us how is it possible for someone with experience to enter the roster?
There is actually on the website, there is a possibility that indicates you can enter into the roster, and then you register on the roster, and then there is a vetting process, and then you will be informed if your candidature is actually included into the consultant roster.
Okay, thank you.
So there is a vetting process, so it's not that if you register that automatically you are in the consultant roster.
Mm-hmm. Thank you.
Recruitment trends. So one of the really important institutional and organizational priorities we have is the family planning initiative. Senen mentioned that, so this is really also in recruitment trends. We are looking for people with experience in family planning, with experience in sexual reproductive health, also in adolescent sexual reproductive health, sexual education. So really family planning in a very larger sense, what we are looking for profiles. And then we have just established a new second regional office in West Africa in Dakar, and we are actually advertising probably in the next 10 days in the framework of this new regional office, 10 new posts at the regional office in Dakar. So we will be doing quite a massive recruitment in Dakar at our regional office for West and Central Africa. The most needed profiles we are looking for, so we are looking for international operations manager. This is basically the person who really runs the office on a very operational level. So we need basically somebody who has brings 3 different skills: HR, finance, and procurement. So this is really people who have been either like managing NGOs, who have been like in the operational side, also in private business, and who really are able to lead a team and to put together a very diverse workforce.
Paolo,
Yeah.
Another question related to that, given that we discussed this already, and quite often we have people asking, do you need to have a reproductive health or a census planning experience to be competitive for an international operation manager's post? So to the core business of the organization, which would apply to other UN organizations, UNICEF or UNDP. All of these organizations do have international operation managers position. It's always the question to know how far do these people have to be familiar with the core business of the organization.
You see, in UNFPA, the recruitment and overall the HR function is very centralized. So the other agencies that you mentioned, like UNICEF, UNDP, they have decentralized part of the recruitment function. This is why their operations manager, they need to know also the business in order to be an efficient strategic HR person. While in our country offices, many of the recruitment, the international recruitment, the high-level recruitments are done either together with New York or with the regional office. So this is why for an international operational manager post, to start with at the P3 level, you don't need an exposure to the business. Mm-hmm. Of course, if then from there on you want to go up to a P4 level post, and if you want to change into deputy representative, then you will need exposure, not only exposure, but really also a knowledge in the business. But this is, and we will speak with that later on when we speak about development, we have courses that we offer, we have partnership with a university in Latin America that really also provides a certification in population and development issues. So once you're on board, then we will help you also to really get a hands-on experience in the business.
Okay, thank you.
And actually, going on from your question to the next one, representative. So we are looking for, this is the country director in a given country. And there you need to have at least exposure in one of the thematic areas, but even more if you have a practical experience in the thematic areas. Because of course, you will be the one who is representing the program in a given country. And the more you can speak with authority on our subject matters, the more you are taken seriously by your partner, which is mostly government partners. So while the international operations manager can really come from outside, a representative with really no exposure in either reproductive health or in population and development census issues will be difficult to sustain the complete recruitment process.
Mm-hmm. And now that we are on deputy rep and representatives, could you elaborate also of the chance for people without UNFPA experience or people coming from the outside to be competitive for this kind of position?
I mean, you don't need to, it's not only UNFPA who works on this family planning, sexual reproductive health. There are much more. There are also UN organizations who work in this field, but you have also NGOs. So for instance, the Swiss midwife, who is now really having a very important role in the South Sudan program, and she has actually a managing role in the midwifery program, she came actually through NGOs. So she worked on midwifery programs, she worked on curricula for midwifery, but with NGOs. So it's not necessarily that also for representative. We have a number of representatives who have been in the past with Plan International. So not necessarily you need the UN experience, but what you need is an experience in the subject matter of UNFPA. Mm-hmm. So that is where you get this experience. It is not so much. It depends, of course, also on the context. If you are in a context of one UN, so where it's delivery as one, where the country office is like Vietnam, then of course we look somebody who already knows the UN. But it depends. We have our representative in Burkina Faso or our representative in Benin. They had not much concrete experience with UNFPA, but they had, one had a solid experience with UNDP, and the other one had a solid experience with Plan. So you see, you need to have managerial experience, and you need to have an experience on the subject matters. This, we are talking now about representative and deputy representatives.
Mm-hmm. Okay, thank you, Paulo.
Then, of course, I mentioned before family planning, reproductive health, maternal health, midwifery. So those are posts that we are really recruiting, and we have a lot of posts that are under recruitment currently. We also look for census specialists, so people who are able to do either the data collection, data mapping, or also the analysis of census data, and then to support the government to actually shape the policies that come out as a result of the census. So this is also a profile we had Swiss in the past applying for those posts. And of course, Werner Haug, who was like the census champion in Switzerland, who has then secured also an important post with UNFPA. And then we have also another post where we have Swiss candidates regularly in youth program and in GBV. And when I speak with youth, then really also we are looking for people who have experience in youth programming, but particularly under the perspective of adolescent sexual reproductive health or in the perspective of HIV prevention. So those are the two profiles that we are really looking for when we speak about youth. And then, of course, we always hire support posts, finance, procurement, ICT, where again you don't need to have experience in the core thematic areas.